Good morning, everyone. How you doing? This is Elliot Garza with MD Monthly, coming at you live with two experts in the medical community with CommuniCare. And thank you so much for tuning in. We're going to have 30 minutes of a Q&A questions. Our topic's going to be ADHD, and it was made to my attention. This coming October is ADHD month. So if you have kids, or you grew up with it, or you thought you maybe have grown up with it, this is the time to actually ask. But feel free to go ahead and engage on the comments and everything else. Today we have Dr. Ume. Dr. Ume. And you, what location office are you at?
Potranco. I'm at
Potranco Road.
Yes.
I believe there's 14 locations?
Yes, and growing.
And growing.
Yeah.
And we also have Dr. Juarez is joining us today as well. Both pediatricians?
Yes.
Okay, great. So we have all the answers, especially best time of the year too. You know, kids are back in school. There's other things as far as age groups that they're growing in, and growing and different aspects of, whether it's ADHD, whether it's another aspect or something they just, it's just part of life. But I want to ask you guys, first of all, thank you so much for giving us the time to meet with us this morning. But what exactly is ADHD? What does that even mean? I mean, what is the acronym for?
Attention Deficit Hyperactivity Disorder. There's different types of ADHD. Some are impulsive and inattentive and hyperactive. That's called the combined ADHD. And then there are some that are just inattentive and aren't so impulsive and hyperactive, and they're called predominantly inattentive ADHD.
Okay, well, as far as ADHD is concerned, there are certain signs that, at what age do people, is it 2, 3, 4 years of age, or when they're in school? How do people start recognizing this?
Well, usually most kids are diagnosed between the age of 3 and 7. That's typically the time where they become more aware that their child might be a little bit different than the other children as far as their attention, their ability to focus. Usually this is the time when they're entering school, pre-K, and the teachers start to bring up some issues that they might be having with socialization, with finishing tasks, with just being able to keep up and focus in school.
Dr. Ume, and as far as the types, there's different levels of ADHD. The term is it's common now. People hear it all the time. I'm an 80s child. I didn't hear much about it. And, I think I told you earlier, during those days, the teachers were allowed to spank us. And I figured, well, that might be, I wasn't paying attention most of the time.
You were just a bad kid.
I was just a bad kid.
So, as a matter of fact, yes. And I discussed with her, and I said, yes, we might, at least in Nigeria, the Nigerian experience when I was in med school in the 80s, we didn't really have much of the diagnosis of ADHD. And then I come to America in the 90s, I'm like, boom, wait, what's this? So, yes, and indeed, to answer your question, first of all, there are levels of anything. There's a severe, really incapacitating, where the child really cannot function. The mother is tired at the end of the day. She feels like she's been hit by a Mack truck. The kid is just rambunctious. Nobody wants to play with him. He's bossy or she's bossy. Won't sit still for nothing, won't go to sleep. And then there's some that are more subtle. And like I discussed with Dr. Patricia, I think I want to say society is almost kinder to the girls because we tend to forgive rather to the boys, right? We tend to forgive the boy. He's just full of energy.
He's just being a boy.
Yeah, he's just being a boy. He hits the ground running, and he's like, wait, why is she acting like that? Why is she more girly? But really, it's an equal opportunity disease. Everybody gets it. It's real. The child is not just wanting to be bad. They just don't want to be misunderstood. They don't want to not fall asleep at night. So yeah, there ranges a full spectrum. There's the mild, maybe not too bad, and then it happens maybe in middle school. They start suffering a little bit because schoolwork gets exponentially harder in middle school. They can get along and kind of coast by in elementary school. It's not too bad. But by high school, we got geometry and algebra and all that. So it's like, wait, what's going on? I'm not able to focus. I'm failing my grades and stuff like that. And then there's some that are not so severe, right? And then it can actually go along until adulthood. And it's like, wait, why do you always forget your keys? Where did you leave your phone? Mom, don't tell me you lost your phone again. That's me.
Yeah, I have
That's
that
me
too.
and my kids. Yes,
My
yes.
kids.
So there's a spectrum. There's mild, there's moderate, and there's quite severe
Okay.
cases of ADHD.
You know, here's a question. As far as the, I mean, half of the 24 hours of the day, the teachers are actually taking care of our kids. You know, I'm sure there's somewhat of experts that can see the signs as well too, correct?
Yes.
As far as the level, I mean, does it slow down? Is it a learning disability as well, to where they're having to concentrate more? Or should they be taught differently or be put in a different class? How does all that come together?
Well, to answer your question, yes, the teachers often have been trained on ADHD and to pick up on those symptoms. However, there does need to be an evaluation because it might be ADHD and it might be something else.
And he touched on learning disability, and that is one of the other symptoms of other what we call coexistent illnesses or comorbid disorders that can coexist or mimic ADHD, as a matter of fact. And so she's right, you have to have a full formal evaluation. But the teachers, the daycare, the coaches, they're the parents' extensions. They're our eyes and our ears. Indeed, they will be the ones that usually are the first ones to say, Mom or Dad, you know, little Ricky, I'm not sure, he's just not having to be redirected all the time, and the mom's like, you know what, I noticed that at home, I thought he was just being Ricky, and it's like, and so they start coming to, well, go see your doctor and see if he has, and then we take it from there.
You know, Dr. Juarez, you mentioned something could be other symptoms, and one of the questions I do have leading into that is what this type of condition, it can be confused, what other type of conditions can be confused with ADHD?
Well, depression is a big one. If a child is being bullied at school, or maybe something's going on at home. So if they're like new symptoms, that he's not concentrating well, that he's having trouble finishing tasks, his grades are going down low all of a sudden, that could be a sign that something else is going on. Also, it could be anxiety. Some children have a lot of anxiety, and this is shown, and that they can't concentrate at school. Bipolar disorder, also, like around adolescence, sometimes this peaks.
And we can have substance abuse in adolescence, now that you mentioned adolescence, especially if it's a new onset. All of a sudden, again, little Ricky, I'm just going to say Ricky, okay? And all Ricky's out there, this is, but all of a sudden his grades are really failing and dropping, his behavior has changed. Think substance abuse, especially for teenagers. They're trying stuff, and they're exposed to a lot of stuff, that all kinds of little candies, masking.
And this can happen within 1 year to the next, or over summertime they come back, or so it's not. Is it gradually growing within the kid as far as the symptoms are concerned, or it just happens all of a sudden?
So ADHD kids, you can recognize that since they're little toddlers and pre-K children. They're little distracted daydreamers, not focusing, maybe not socializing with other kids. So you can recognize this pretty early.
You can.
Yes.
I usually, like I told Patricia, I'm like, I know he's going to come back. I just know he's going to come back. I just know that because he's 2 years old or he's 3 years old, and right now he's just like, but you don't do much at that age, very young, because that can also be a regular terrible 2 or toddler. But once they get into the structure, pre-K, when everyone is going to the left and your little Ricky is going to the right, when everyone is taking nap time and he cannot settle down for nap time, then we start getting concerned a little bit. Excuse me.
Yeah, and this is home as well too, because I'm a father of she's going to be 5 October 22nd.
Congratulations.
And she's just as active as I am. And you know, it's these type of things are very advantageous to learn as far as education and looking out what signs are going to be there. And I think I have the most perfect little princess in the world, so thank God. But these type of things, when you're saying it can happen in the 3rd or 4th grade, and all of a sudden their grades are dropping. I mean, there's always awareness that you need to go ahead and be alerted with, right?
I'm glad you mentioned that about your daughter, because indeed it's 76% transferred from parent to child.
Wow.
And a lot of my patients and their parents, or should I say their parents, get diagnosed after I diagnosed the child. And it makes so much sense, like, oh yeah, so that's what That's what's been happening to me. The parents, like a light bulb moment. So that's what, so okay, so then, oh, I see, little Ricky got it from me, or whatever, So yeah, absolutely, there's a 76% transmission from parent to child. So a lot of the parents see themselves in the kids, and it's like, oh, okay, now I know what it was that I had, and when I had whatever I did that I had.
So mention I have a little girl, and this is really tough to swallow when it comes to treatments. Okay, treatment options when all parents are like aware and alerted as far as, oh, I don't want to overdiagnose, I don't want to make sure she's not on medication or he's on medication. So what are the treatment options for medication and ADHD? And at what point do you feel a kid would need to be on any type of treatment options?
Well, the American Academy of Pediatrics recommends that other modalities, other management options be tried before medication in children under the age of 6. So your daughter is 5 years old. So behavioral therapy, a big one for us, I think, is education. So for the parent, going to ADHD classes, parenting classes, to learn how to redirect their child, to learn how to help them focus, how to organize themselves. This is key. And this would be the first thing that should be tried. Now, if this fails, meaning that they're a danger to themselves, to others, say they're really accident prone because they're so impulsive, they're breaking their arm, they're always in the emergency room, or they just can't function at school. They just are about to be kicked out of school, things like that, then we would consider putting them on medication. Other things that can be done, some children with ADHD have fine motor issues. They have trouble with their handwriting. This interferes with their schoolwork. So occupational therapy has also been found to be useful. This can help with the hyperactivity also. They can do some exercises with them to help them focus and also with their fine motor skills. Other things that are out there would be supplementations. There have been some studies that show that omega-3 does help with concentration in ADHD.
Oh, really?
Yes, as a matter of fact, yes. And then, of course, we have to face it. We have to bite that bullet. Sometimes you just have to do medication. And so for classifications, there are two major classes of medications. There's the stimulants and the non-stimulants. And yes, stimulants as in stimulants, right? There's a paradoxic effect of, for some reason, research found that patients who are given stimulants, you would think the child is already hyperactive. Why give a stimulant, right? It's a paradoxical effect. They have this effect of calming them down. Now, I'm not talking about coffee, because if you give me a drop of coffee, I'm over the roof. I'm talking about stuff like amphetamine and methylphenidate. They have been studied extensively. The big one out there is Ritalin. Everybody knows Ritalin. I don't want my child to be on Ritalin. I said, okay, don't worry about it. We're not going to do that first. We have to educate. Once the parents get that sense of ownership and knowledge and know that, okay, this is not this child just trying to be bad. This is not this child just trying not to cooperate. Then it's easier for me to kind of sell the medication. And then they coming the next week or the next month, they're like, Dr. Ume, thank you so much. I'm so glad. I wish I had started earlier, because it's like night and day. You don't always hit the right note the first time. Sometimes you have to build up on the doses. You have to kind of give it some time to get there. Nobody looks like a 20 milligram or a 30 milligram. You have to start from the lowest dose and then build up. But a lot of times they already see changes and already see positive differences, and so the kids already start responding like right away with the stimulants. Right away, like that day, they start, she's like, something is different with this kid, and that, so you know you've hit the nail on the head. For some kids who do not tolerate stimulants, some of them, because they do have side effects, they can have hallucinations, they can have poor sleep. For those, we can also try the non-stimulants, which may not be as effective, but also still work.
Thank you so much, guys. This is good, valuable information. And again, like I said, it hits home because I'm always now going to be, I love my profession because I get to listen to experts every month and ask all the questions possible. I'm a master of none, even with the education, but it's a process in learning too. I mean, as a first-time father, everything else while she's growing up is going to be new to me. We've had people who've engaged and decided to ask some questions. So, woohoo! Jesse, can you read one of the questions, please?
Yes. Audrey says, does taking medication too young harm their mental and emotional development? Will they ever get off this medication if they start taking it?
So 1/3 of children will outgrow their ADHD. That means
Wow.
2/3 of adults will not. However, as you grow and mature, you learn different ways to organize yourself. You
That's
pick
right.
jobs maybe that really interest you, so you're able to concentrate better in that. So they may or may not outgrow their ADHD. Will the medication hurt them in any way? Actually, it will be a positive influence.
That's right.
Because they're struggling, their self-esteem is low, so they start getting depressed, they start like not being liked by their peers, maybe having trouble with social interactions. So it actually helps them with their development.
Thank you so much, Dr. Juarez. There's a theme music going on while you're
Calming.
calm. We have another question, and we'll go and repeat it. Just go ahead and say the question. We'll repeat it back to them.
Philip says, what are some basic techniques children and adults diagnosed with ADHD can do to focus? So what are some techniques that they can use? If they're
Home
diagnosed?
techniques?
Like at home. Okay, well, I mean, I guess one of the things that Dr. Juarez already kind of touched on is if you, as an adult, let's go with adult first. If you know what you're good at, like for me, I can wake up in the morning, I'm this energetic when I wake up. So what do? I go for a run. I do a push-up. I do my workouts, and I know that because I kind of get my energy used up a little bit that way. So if you know yourself and you do something, you get into a job that uses your skills, your natural talents, then you're already kind of in a good place. If you put me as a librarian, it's going to be useless because I can't even sit still in the library. So just as an example, so that's one thing you can do. For children, for instance, at bedtime, most children now have a handheld device. I can't stand that. I don't like it.
Wow.
The lights are on, the TV's in the room, there's so much noise. For kids who are already stimulated, you don't need all of that going on at bedtime. So for instance, you want to maybe take a bath with something with lavender, some nice smelly salts. You want to turn off all of that stimulation, turn the lights down, take away that handheld device. There should be no TV. The AAP actually does not recommend televisions in kids' rooms. Take out the TV, take out all the stimulation, and maybe we can get the child going to bed maybe a little bit earlier, start getting some healthy routines for sleeping, things like that, you know?
So to help with concentration, sleep is big. To make sure they're getting enough sleep, to make sure they're having quality sleep. Also, exercise. It's wonderful for their mental well-being. They tend to have a better attitude with school. It's a stress reliever. It helps them sleep better at night.
That's right.
A good diet as well. So eating healthy, avoiding high sugar foods, avoiding the caffeine, making sure they have a nice balanced diet with protein. All those things help.
Yeah, we were talking about that breakfast in the morning. Most people just get Fruit Loops, and I just love to use Fruit Loops. I mean, I have nothing against Fruit Loops, but it's so sugary. The kid is charged already. But if you did something like maybe omelets with some green beans, I know nobody wants to wake up in the morning and make that breakfast, but that's going to already kind of calm them down. A very sugary breakfast is going to, a Pop-Tart is going to just shoot up the sugar already, and they're going to go to school bouncing already, you know, so...
Yeah. Oh, Ricky, always getting in
I
trouble.
know, poor Ricky. I know. We got Ricky. Ricky's.
We have another question coming in. Jesse, go ahead.
Audrey says, where is the line between a growing child with behavioral issues and one with actual mental health?
A growing line between behavioral issues and
One with actual
mental health. Where's the line drawn between those two?
So we actually do an evaluation called the Vanderbilt form, where we try to get as many people as possible to fill this out. Teachers, people at home, parents, grandparents, and we actually evaluate for conduct disorders, which would be in that line, to differentiate that with ADHD.
We also, and if the form also has a part that tells us if the child has ODD, which is oppositional defiant disorder, picks fights, wants to fight all the time, is defiant, is like, no, I'm not going to do it because he said I should do it. So those are more on the mental side, and that's not actually ADD or ADHD. The ADHD kid is the child who just is restless a lot, just can't sit still. But it's really not, I wouldn't describe as I hate to use the word bad, but you know what I mean? Like, it's not that. And then, of course, when you give the child the treatment, if it doesn't work, you pull it back. So it's not like you must take this medicine for life. No, you take it, we try, you come back. If it's not working, we might go up a little bit. If it's not working at all, then maybe it's the wrong diagnosis. And we are very open. In CommuniCare specifically, we have psychiatrists all over the place. We have counselors. So we make a referral in a minute. I mean, I co-manage my patients with a psychiatrist all the time because sometimes it's not pure ADHD. Sometimes if a child, God forbid, has been abused or has a reason to actually act out, all the medicine in the world is not going to fix that. So maybe they need counseling. Maybe the parents need counseling. Maybe we need to change the home environment. Some kids act out more, maybe with their parents and less with their grandparents. I mean, who knows? But a lot of times it's not a one-stop shop, and it's definitely not a short-term thing. This takes months sometimes to get to where we are. But once you get there, you get there. You get there.
Well, thank you so much for asking that question. I believe we have another question coming in. Jesse?
Linda says, can certain medication cause ADHD?
Can certain medication cause ADHD?
No medication that you can take can cause ADHD, but it is interesting if the mother, while pregnant with the child, maybe used drugs and smoked, there is a greater incidence of ADHD with that in the child.
And also premature babies have been found to end up having a little bit more ADHD, is more prevalent among premature babies. Another way to answer that question is, in a sense, you could say yes, because some medications will give you the symptoms of ADHD, like hyperactivity, like caffeine, for instance. You all know if you give me coffee, I'm going to be jumping off the wall because I'm already generally on a baseline excitable. So for some people, the medicine can make them a little bit more hyperactive, but not, like she said, not that you now become a patient who has ADHD. Steroids can also kind of give you a lot of energy. So yes, there's some medications that can have a side effect of excitability a little bit. So yes and no, but you don't get the diagnosis of ADHD because you're taking the medication.
I hear you. You know, as far as Dr. Juarez, you had mentioned earlier, you answered the question as far as treatments is concerned. Is there other options outside of medication that people can take advantage of? Is it diet? Is it exercise? What are the other options outside of medication?
And I think they should. Every ADHD patient should do all of these things.
All of the above, yes.
So, and depending on the severity of the ADHD, sometimes doing some of the initial behavioral therapy, neurofeedback is another one that has come into play that has been shown to be effective. So this would be done with a professional, with a psychologist that does neurofeedback. All of these things in conjunction with the school. The 504 program in the school is very important to get the school involved so that the child has preferential seating, maybe they have more time to take tests.
Okay.
All these things would be important to do.
I believe we have another question coming in. Jesse, what's the next question?
You touched a little bit on it, but what communication and relationship do you have with the children's education to make sure they are benefiting within the school area?
And so I think Dr. Juarez kind of touched on it, you're right. Indeed, the teachers, oh my God, we love our teachers. They are our eyes and our ears in school. They do help a lot. Sometimes I see a parent, I can hear them say, well, the teacher says my child has this. But the truth is, the teacher is really just your extension. She's just trying to tell you what she's noticed. And then when we indeed get the parent to sit down and think about it, they have also noticed those symptoms. So yeah, the teachers do help, giving them more time to testing them even for dyslexia can be one of the things that you can do just to make sure that is that what is masking as ADHD, and then they can get all the help that they need. Extra time to take their test. Maybe some people learn more verbal, some learn with more, pictures more than writing, and whatever it is that's going to be tailored to the child's needs. Like I said, it's a multifaceted, multifactorial. It's never just a pill that's going to fix it. It's really more of a management. And I think everything starts from education, educating the parents who are the first teachers, and the teachers, and even us, the doctors. We have to see you frequently because it's like things are constantly changing, and say, where can we tweak this and tweak that, and where can you get all the best help you can. I know the YMCA is a big resource for kids. They go there, they use up their energy, and some of them also help with teaching too at the YMCA. So I'm all about just a multifaceted approach rather than just take this pill and you'll be fixed in a week.
True.
So that's a good point that you brought up. A lot of children with ADHD don't only have ADHD. So that's where the school comes in to check for other learning disabilities and dyslexia. I think that's very important.
That was a very good question. Thank you for asking. Do we have any more questions on the list? You know, as far as resources, because you earlier mentioned parents can take some classes, I guess how to manage or engage with these type of symptoms with their children. What are the great resources right now that are being offered for parents when it comes to ADHD for their children?
So CHADD, C-H-A-D-D, is a children and adults for attention deficit disorder. The CDC is the one who sponsors it. It's nonprofit. It has lots of information there for you. Of course, the pediatrician is a good place to start with the evaluation, and then there will be resources in your community. For example, here in San Antonio, there's the ARC of San Antonio, which is an advocate for the family and the child to work with the school. So there are many resources out there that we should take advantage of.
As a matter of fact, next in November, I think November 11th through the 13th, there is an annual international conference of ADHD, which I didn't even know until we started researching into this. And indeed, she mentioned CHADD, which I think is huge. They have a giant website with all sorts of information, all kinds of printouts. It's just so full of information. I was floored when I was looking at it. So I strongly recommend that. And of course, here at CommuniCare, we have specialists, we have counselors, we have nurse practitioners who counsel, we have psychiatrists, and we have us. So we can make an appointment, and we can make a referral if we need to. Oh my God, there's just a lot of, just reach out and kind of get started, and you will find someone out there to help you for sure.
I think for parents who have a child with ADHD, it's important for them to connect with other parents. There's magazines out there that help you know that you're not the only one that is dealing with this, and so to get that support, it's important.
Dr. Juan, how common is ADHD?
So
it's a common term, but how common is it in children?
Worldwide, it's 5%. In the United States, the CDC had one putting it up at as high as 11%. Okay. So that would mean in a classroom setting, 1 out of 10 children might have ADHD of some type and degree.
I'm so glad she mentioned worldwide is 5%. We were discussing this, and I was like, sometimes culturally, you get a little bit maybe more acceptance of the diagnosis, and so you have higher diagnoses. You have more patients being diagnosed with it, and in a different custom. And I was reading about, and I'm just going to throw it out there because it is in the literature, Indians, for instance, you get a lower prevalence of that. Is it that they don't have ADHD, or is it not accepted, or is it that it's just culturally it's a different energy and a different, I don't know, diet, or there's got to be some things that make some countries like the United States, for instance, have a higher prevalence, and Nigeria, for instance, not have a high prevalence. So yeah, there are country differences, but indeed 1 out of 10 is pretty, it's a lot of people. It's a lot of people.
Was there any more questions as coming in? Jesse?
Dr. Adatona says, is ADHD a psychiatric illness, and is it genetic?
Dr. Adatona?
Hi, Dr. Adatona. We actually already kind of talked about that. Indeed, it is a psychiatric illness. It is. However, it can be managed by general pediatricians like us. We do also co-manage them with psychiatrists, because sometimes you have comorbid disorders like anxiety or depression or other things, bipolar disorder, which can also mask, and even autism can have ADHD as a core symptom. So it tends to be like a group kind of like a group therapy type thing, the pediatrician, the psychiatrist, and everybody else. And yes, 76% genetic, yes, absolutely. At one point you have nature, which is the genetics, and then you have nurture, which is where do you live and what's going on in the home and what kind of environment are you exposed to. So you can have a combination of those, but yeah, there's definitely a genetic component to it.
So if you're an adult with ADHD, you 1/2 to 1/3 of the adults with ADHD will have a child with ADHD.
That's right.
So it's highly genetic. They haven't found out exactly what genes they are, but there are ongoing twin studies that show great promise and leading more to that. It's been shown that norepinephrine and dopamine, there's an imbalance in the brain of those. There are actual differences in the brain with children with ADHD that the studies have shown. So the significance of that, we're not quite sure yet. That's ongoing research, but yes, it's definitely a genetic component.
Yeah, and it's the frontal lobe of the brain, which is in charge of organizational skills and impulse control that is affected. And this is the frontal lobe is here, and it's where the norepinephrine and dopamine receptors and the levels are a bit different in a child who has ADHD. I mean, they're basically in a constant state of awakeness. And so that's why when it's bedtime, it's hard for them to go to sleep, to fall asleep, and even to stay asleep, because they're constantly just thinking about something. Their mind is working 25 miles an hour every minute.
What can we tell the first-time parents, or even parents that are very involved, overly involved sometimes, so they just freak out with everything, to where they may go to WebMD and it's the worst thing possible they could possibly read. As far as ADHD, there's options out there, correct? I mean, what we've talked about, so it's nothing to be overly concerned about. Because we have experts like yourself to call on and to have a resource, correct?
Your child will flourish, and with the help of the parent, the support of the school, and their pediatrician, and there are many resources out there that can help your child succeed. There are many famous people we were talking about.
Yeah, we were talking about
that have
I've been waiting for that part. Yes, there are many famous faces that have ADHD. You want to give them a few?
Well, Albert Einstein.
Hello.
So, he's smart.
No
that means your
there.
child it doesn't mean anything about the intelligence of the child. If you have ADHD, you can be really smart. There have been Picasso. There has been thought to have ADHD. Presidents like John F. Kennedy have been thought. Woodrow Wilson. Yes, and there are many artists out there.
Like Will Smith and Simone Biles, the gymnast, Michael Phelps, of course Jim Carrey. We all kind of no surprises there. So yeah, and then there's some famous doctors in the house who have ADHD and coping very well with it. As long as you can channel your energy. I think it's all about education, coming to acceptance. I know my family's like, Mom, you're always looking for your phone. Just attach it to your hip. Yes. I'm always looking for my phone. I never know where I keep it. So
there are a lot of entrepreneurs that have ADHD. Andrew Carnegie. So
yes, I saw that.
People out there. It's been shown that you're 300% more likely to start a business if you have ADHD.
There you go.
So that energy can be channeled to very positive things. So having ADHD is not a bad thing.
No, it's not. I think it's more important though that the parents, I think for me, my take-home message would be just start, take the first step. I was telling Patricia that I had a 16-year-old maybe 2 or 3 weeks ago, for the first time finally reached out because it's college thinking time for him, and he's really like struggling. He's been doing very well playing in the band and kind of just smooth sailing-ish, always struggling a little bit, but this final year, he's a junior, I think. So this year, he just had so much trouble. He finally said, Mom, I just can't focus. And so they came to me and we started talking about it, and then he came back and he was like a different child because he knew about it. So I told the mom, I said, Mom, first of all, tune into this program, but second of all, spread the word. True. Take the sting out of it. Take that negative energy out of ADHD. It's not a bad thing. It's like
No,
any
it's
other
not.
chronic disease. It's like diabetes. I tell you, it's like asthma. Would you not give your child his medicine if he had asthma? It's a chronic illness. And like any chronic illness, it's not just your medicine, it's also controlling the environment that the child lives in and educating everybody that is involved in the care
Thank
of the
you so
child.
much. You know, with that said, I'm a strong believer of faith. Every child is a gift from God. We're instruments in this world to be utilized the best way. We all have our special talents,
That's right.
and we will grow into those talents. And the best thing for parents to do is a reassurance to bring those gifts and those skills that the child has. I want to thank you, Dr. Juarez and Dr. Ume.
Yes.
I love saying your last name.
Ume, yes. Thank
Dr.
you so
Ume.
much. Oh my God.
And if anybody has any questions and they want to make an appointment, there's several locations throughout Texas, which is in San Antonio, Hays County, and Bernie. The phone number is 210-233-7000. Again, they'll direct you to the right, the most local clinic or within San Antonio or the surrounding counties as well too. I want to thank you.
Thank you.
It's been a beautiful morning. Great way to start this with information to take home to your loved one and kiss your child today because they're special. Thank you so much.
Hug them.
Thank you so much, everyone. Thank you for tuning in.